to be on the dais this evening. And I thank Dr. Srinivas Kasha for introducing me to the audience. The theme of this meet is supposed to be my amazing journey and how I became a legend. But I felt neither was my journey amazing, nor am I a legend. I never thought so. So I thought I will share some of my life's experiences. Directly go through this? No. Now, my journey was rather checkered. It was not a smooth journey, as I will take you. I did my basic medicine in Jipmar, Pondicherry. I belong to the second batch of the Jipmar, and I became a registrar there after my senior house job there in 1965, before I went for my MS. I was the only registrar for a 30-bedded unit, and I was on duty 24/7. All the 6 months I worked there, no day off. But I was very happy that I was learning more and more practical points. I had a grouse that I was on duty all the days. That helped me a lot, and my achievement was my first paper I published from Pondicherry on the cyst of the lateral popliteal nerve, ganglion cyst of the lateral popliteal nerve. Well, from there I went to All India Institute of Medical Science, Delhi, and my MS Orth was for 3 years. That was the borderline. They were making two. That was just made from 2 to 3 years. They made the course. This one. My half life was spent in experimental surgery. So my professor was told by someone that nobody in the country is doing experimental work. So if you do some experimental work, your name will be known all over. So that was the brunt on me. I was asked to do experimental work for my thesis. My thesis was reparative osteogenesis in rat's femur. And at one point of time, I was owning 500 rats, like a cattle. I can count on them. My thesis was, I used to make a small 1.5 mm drill hole in the femur of the rat, and I created an experimental model so that subsequently somebody wants to see the osteogenesis potential of any substance. They can use this as a model, put the substance in the small hole and see how the osteogenesis is accelerating or not. So that was but half my life was spent in the experimental work. I was the surgeon, I was the anesthetist for the rats, for everything myself. And this came handy when I failed in my MS exam, because I had to sustain myself in Delhi. One company gave me a fellowship of rupees 300 to test the effect of anabolic hormone in rats. So this came handy for me. So my policy was, whatever comes your way is for your good. Take it. That was my policy. So don't lament on it, and somewhere it will help you later on in life. Well, after that I came back to state service. I was posted in Kannur Medical College. I was there for 3 years, where Dr. DR.ASRao was in the final year MBBS, when I was assistant professor there. There is no COM, no portable X-ray. So we had to work on fractured neck femur, use the age-old methods like anti-sphenic spine, base of the trochanter, put a guide wire like that. And I was disappointed. 6 cases I did, 2 cases failed. The guide wire was not in the neck, so I stopped doing this fractured neck. But I wanted to use my time there usefully. I published 2 papers from Kurnool, one on the guinea worm infestation and second was the hydatid disease of the bone. Make use of your time. My policy again was make the best use of your time, whatever is available there. Then I moved to Rangaraya Medical College in Kakinada, where Dr. Rangachari was head of the department. But I wanted to learn from him. But no sooner he went away to Vizag, so I was again. The story repeated, inadequate surgical facilities. So I tried to perfect my conservative methods of treatment, because now many people are used to the operative treatment. I feel even now the conservative management, reduction of fractures is more difficult than the open reduction. So all the 7 years I was there, I practiced a lot of close reductions. And for some reason, congenital muscular contractures were very common in East Godavari district. So I started collecting cases of congenital muscular contractures, especially the quadriceps fibrosis and habitual dislocation of patella. And subsequently I went on collecting cases for the next 30 years. And this was the topic of my oration subsequently, that I can boast I have worked hard on that subject and I have learnt a lot. My chief there helped me in not interfering with my work. Why are you collecting cases and all? He was not interfering. So I was left a free hand to do whatever I like by collecting cases. And then I migrated to Hyderabad because my wife got a seat in MD here. I worked with Professor Dr. Vijayaraghavan in NIOS, that's the Nizam Institute of Orthopaedics and Specialities. It was not NIMS at the time. And I can say I refined myself under Dr. Vijayaraghavan. I fine-tuned myself. He was a great teacher. I am ever grateful to him for that, for making me a better orthopedic surgeon than what I was. Then I was interested in scoliosis because my assistant professor in All India Institute was doing scoliosis. I thought I'll specialize in that because not many people doing that work. Luckily I got a fellowship in the United States on scoliosis. But the then Director of Medical Education refused to forward my application because I was receiving stipend. So I pleaded with him, sir, how will I go to United States without a stipend or anything? No, you are receiving money, I can't forward your application. So I lost the fellowship and they said, wish you all the best next time. Okay, that's gone. So I applied because I used the histology in for my thesis. I got a fellowship in orthopedic pathology I was interested in. And again, it was another Director of Medical Education who stood in my way. It took 11 months for me to get 1 year leave on loss of salary. At the end of that, because it is a J1 visa, they wanted a certificate that Dr. DR.ASRao's training in the United States is useful to our country. The director will not give me the certificate. He said, whoever wants a certificate, will I give? No, get lost. Then I was a little more wiser and gone to the IAS officer who helped me to get the certificate. Finally, I could go to the United States and worked in the hospital for special surgery in New York under Professor Peter Bullo. And it was an excellent experience for me. He was not only a pathologist, he was a great radiologist also. I learned so many things from him, especially the clinico-pathological radiological correlation and how an orthopedic surgeon should be involved in that. But my experience with the medical administrators they are more inimical to the doctors than the IAS officers. I'm sorry if I am hurting someone, but the medical administrators, I expected them to help the doctors, gain knowledge, come back to your own state and then help the medical students here. But at that time I thought, if at all I have power in my hand, I should help people. And I kept my word when I became principal of the Gandhi Medical College and became superintendent of the hospital. Wherever I could, I went on helping people without expecting anything in return. Then I realized that we need a godfather for your progress. Whatever is your intelligence, you need a godfather. But that realization of mine was too late realization. So I thought, I will communicate to my juniors. Try to have somebody to help you. If you are intelligent, you can climb the ladder faster. Then I created a word called the fear-affection complex. What does that mean? We should be strict and people must be afraid of us, that this man will not leave me. But at the same time, they should be affectionate. They must love you. Otherwise, things will not work. And this dictum of mine, fear-affection complex, worked very well with me, both for the medical students, my staff in the college, my staff in the hospital, everybody. They were afraid of me, but they used to love me. But this man does a good job, and unless we do a perfect job, he will not leave. So this helped me a lot to come up. Then I thought I should do something for the orthopedic fraternity, and then with the help of Professor Vijay, I started the Twin Cities Orthopedic Society in 1985. Even now it's running very well from that time onwards. And then the Orthopedic Association of South Indian States, people were trying to have a South Indian society, but they have been failing. So 1 year I spent on this. Why people are failing to have a South Indian Orthopedic Society? So then I realized elections and collections are the two barriers. We must have the collection of funds is the real problem. So I thought we'll leave it to individual states to collect funds and send to the center. And then elections are also left to individual states. They will elect a member and send to the OSS. So half the problem was solved. And I can, as Vijay Ramarao has said, myself and we started the 2002 was first inaugural conference of OSS in Hyderabad. This gave me a lot of satisfaction that I have done something for the orthopedic fraternity. I will be remembered for a longer time. And then I had a passion for teaching from my beginning of my career. We should start teaching early. People, when they get promoted as professors, then they start teaching. You can't become a good teacher overnight. And this teaching gives enormous satisfaction that I am doing something good. I have learned something from my seniors. It is my duty, moral responsibility to pass on the information to my juniors. With this, I continue even now, as Srinivas Kasha has mentioned, I come to Kim's Hospital once a week to teach students, and a couple of my patients I see. And I go to Gandhi Hospital every month, take a couple of my friends and conduct PG clinics. Because as I said in the general body yesterday, there is a lot of advanced technology that's being discussed in these conferences. But basic PG teaching has been neglected in many places, especially for the D&B students. In the corporate hospitals, sometimes they don't have much time. So I thought every month, once a month, I take clinics for the students of the students, MS, D&B, whatever it is, all over the city, they are welcome. That gives me enormous satisfaction. And also, we should collect material from our young age, can give talks from our own material, not from books. So the youngsters, now it's very easy, you've got digital cameras and all. At my time, there was no, I had to spend a lot of time, lot of money on photography. If somebody wants to be happy, you should be honest. Take whatever comes your way. Destiny cannot be altered. But you can be, if you're honest, we'll be happy in our lives. That's what I practice. And Professor Robert Salter, the great pediatric orthopedic surgeon from Canada, said, decisions are more important than incisions. That conveys a lot of meaning if we really analyze that sentence. And my policy was always operate and take money, but do not operate for the sake of money. If you follow that, and whenever I was giving an advice to somebody, I used to think in my mind, do I offer this surgery for my own relative? If so, and do I think I can make his life better? If I think yes, I go ahead with the surgery. It was very satisfying for me that as examiner or inspector for DNB from Chandigarh north to Trivandrum in south, and from Baroda in the west to Nagpur in the east. And I met so many people in my life, and so much of their experience I have imbibed myself. It was very satisfying for me. And the NTR University of Health Sciences has designated me as an emeritus professor to Gandhi Medical College, which I feel I am obliged to them. So even now I go to Gandhi Medical College and teach students once a month, as I said. And the IOA has conferred honorary fellowship on me, and this also gives me enormous satisfaction. My other policies, what I was following were, be good to people. This is a sort of meditation for me. Be good to people. There is no need to go somewhere and meditate. Help others wherever you can without expecting any returns. Even now I follow that. I did about nearly 200 polio surgeries free of cost in my practice without expecting any return from them. If I didn't like someone, I didn't think of him. No point in trying to take revenge on somebody. Don't think of him. That has been my policy. Take whatever comes your way and make the best use of time. You may not be expecting that. Instead of crying or lamenting that I didn't get this, make the best use of time. Of course, incidentally, I always used to feel that I did not go to United Kingdom, and a lot of people used to think he hasn't got his FRCS. But that didn't deter me. In my teaching experience, I had full satisfaction of having transmitted my knowledge to my youngsters. Destiny cannot be altered, but see that we expect the best. Whatever comes, you take it. This has been my experience. I don't think I'm a legend. My policies made me what I am today, and in spite of my checkered career, I am happy today. In spite of my disability, I thought I should take part in all academic activities, and I should thank Dr. Srinivas Kasha for making special arrangement for me to come onto the dais. I'm really grateful to him, and I have been seeing him ever since I joined KIMS. He was a fellow at the time, and he has risen to great heights. And once when in Ramayana, somebody has to cross the sea and go to Lanka, Sri Lanka, and people are all thinking, who will cross, who can cross? Then Hanuman was there, and somebody said, "Arey, you are there, you don't know, you can fly yourself." Then he flew like that. I did not know the capabilities of Srinivas. Now he has proved himself to be a great organizer. And yesterday I was telling that I have seen so many state conferences from 1968 onwards, ever since I came back to Andhra. And I've seen so many other state conferences outside our state also. This conference is no inferior to anyone. There is no question of inferior. This is far superior, as people have pointed out. The time management is excellently done, and new concepts have been introduced instead of following the good old traditions. New concepts have been introduced. As somebody said, it may be difficult for the next organizer to keep pace with him. And Somsekhar was another silent worker. He doesn't talk much, but he does a great job. Between these two, I think they have done a wonderful job. And today I am very, very happy that I am able to talk here about, I might have bored to some extent, but I have great satisfaction that I have shared my life's experience in short with all of you. Thank you for the opportunity given to me today. Thank you very much.